am a comeback champion, and I am excited to talk to you today about my journey and why I consider myself a comeback champion, as well as I'm sure a number of you have signed up for this phenomenal conference. Excuse me. So, something that I wanted to talk to you all about today was my journey and why and what has made me become a comeback champion. And what does that look like for me? We all have shared experiences that we have dealt with that have brought us to this space, that have tested our strength and challenged our spirit and pushed us to the brink of our endurance. So, about my journey, I was diagnosed with endometriosis when I was 19, so over 20 plus years ago. And during that journey that has followed me throughout my entire life until present, there have been ups and downs and areas where I've had to really tap into my resilience. It's been a journey of resilience, of self care, and survival, honestly. And as you all well know, and I'm sure, this is not a journey for the faint of heart. It's for warriors like yourself, like myself, that I have proven to be dealing with and maneuvering through what life has served up to me and how I've had to choose to respond to it. So with my daily battles of endometriosis, and I was also diagnosed with adenomyosis and also with fibroids. And most recently, I was diagnosed with a brain tumor. And I'll get into that into a little bit. So these are all the things that I have survived, and I'm here to talk to you about because I don't look like what I've been through. And I'm sure a lot of you don't. So where does that leave us, right? So when I was diagnosed, I was told I was in college and they said, you were probably not going to be able to have children. You should just have a hysterectomy right now. And as in my day job, I'm a public health analyst. I'm a contract officer representative. So being told at 19 that you can't have children and that you should just have a hysterectomy, that was crushing. That was devastating for me. I had gone to 25 different OBGYNs trying to figure out what is going on. And just to give you a quick background as to what endometriosis is, it is a disease of the reproductive system where the lining of your uterus that normally sheds during your cycle somehow finds its way outside of your uterus. And more often than not, a lot of women always just dismiss it as cramps. Oh, I just have a bad period. And it's not. They're not normal. 1 in 10 women have endometriosis, but it takes about 7 years for you to be diagnosed. And then you add the socioeconomic situation, the social determinants of health. It puts us as Black women in a whole different category as far as late diagnoses, misdiagnoses, and just being dismissed for our pain. And when we have to go to that emergency room, and it's a lot.